Hi everyone, Professor Delaney here again. Today we're going to just go through the setup and procedure of a PICC line. If you're right there, come this way. Right, so here we have everything required for a PICC line. Have a look here. It's a bit of a mess right now, but Viv will tidy it up for the stage of when the doctor comes in to insert the PICC line. Right, so Vivian's going to drop everything that we need on the trolley. First off, we're going to drop some normal saline. It depends on your hospital practice as well. She's drawing up normal saline to do all the flushing. So we'll flush everything with normal saline, but she'll also is going to draw up hep saline because at QE2 hospital we hep lock with hep saline. But the jury's still out. It doesn't really, it depends on your hospital protocol whether you hep lock with saline or hep lock with hep saline. So she's drawing up her hep saline, now she's going to draw up her xylocaine at the very end in her 5ml syringe. Once she's drawn up the xylocaine, she's going to put her orange needle straight on the top so we don't mix anything up, even though it is in a 5ml syringe. At some practices they'll use a different colour syringe for their xylocaine. This no doubt probably happens at the Gold Coast where they use a green syringe for all xylocaine. Righto, so if you zoom in over here, Viv is going to start flushing all her needles, dilators, just with saline. You can like flush it onto gauze, or you can also flush it into your kidney dish. It's up to you. Make sure you always flush your main needle because this is now coated, so hydrophilic coated. So it will work a lot better when it's wet or moist. So then you're going to flush, we're going to use a single lumen today, so we also flush that. Then we'll preload it with the wire that she's just flushed. Are you zooming in down there? Make sure that we always put the soft tip in, okay? Soft tip always. Now with this little wire here, the main wire that you put in after you put your introducer in, dilator, always check the end when you're passing it to the doctor. These days most wires have got soft tips both ends, but back in the day, or even some PICCs still have a hard tip and a soft tip. This gentleman is having a PICC line in his right arm. We do most of our PICCs in the right arm here. We also, as you know, use arrows PICCs. Some places will use barred. If you're using barred and you're not cutting, we'll always use the left arm so that the PICC line ends up being shorter. But if you're in other places, we cut the barred to size. So see the setup for a right arm, most doctors will come in with the ultrasound machine in this position. If they're left-handed, they'll have the ultrasound machine where I'm standing now. And I'll look at it with it facing to them this way, like this. Okay, getting back to the setup. Depending on what hospital and what protocols you're following according to that hospital. Some places will use a tegaderm with the Chlorhex patch in the tegaderm, and other places will use a bio patch like this one here. Okay, when it comes to cleaning the arm, we've got two types of prep stick that Queensland X-ray orders, a ChloraPrep stick, which is the pink lollipop, or the ChloraPrep stick, where you hold it down, hold the two ears in and let the ears stay fully clenched in, like so that it lets all the fluid drain out of the prep stick. Then we can clean the arm. Okay, we'll put a sterile, someone will assist and hold the arm up, or we'll put a sterile towel underneath. And then we start prepping the arm. As long as we're prepping everything that's going to be exposed. So if you don't get right under the arm, it's okay, because it's going to be down on your sterile stick, but everything that's exposed around the sides or around to the other side. So from the tourniquet right down to below the elbow joint. Are you getting a good picture there? This is also depending on what Picc kit you open. Some are a full body drape, whereas others, we have a shortage right now, we've only got half drapes. Righto, so now we call the doctor or Picc Insertion and let's get started. Oh, we're back again. We forgot the ultrasound probe. Also, while we're doing this ultrasound probe, look at Viv's set up nice and tidy. Beautiful setup there, Viv. We also use a few types of ultrasound probes within Queensland X-ray. Just get familiar with what you've got. They all have their own little weird technique of putting them on. This one's one of the best ones. Okay, now we're ready to insert the Picc. So we're all ready to go. We'll just tighten the tourniquet up. And now people look for a vein. So first off, we found our vein, and we'll start off with a little bit of local anaesthetic. Viv's going to finish with the local. Now she's going to pass it back to in your sharps dish, and then I'm going to hand over the entry needle. While the entry needle, the doctor's got the entry needle to access the vein, I'm going to have my wire with the floppy end ready to hand over to the doctor. So I'm handing the wire over to the doctor. So then we're going to make a little nick. And then I'm going to get the dilator ready and my sharps container ready. And then we'll help the doctor with feeding the dilator onto the wire. And sometimes you need to put your spectacles on. It's hard to see. Next we're going to make sure we've got our Picc line with our preloaded, ready to go. Doctor will take out the first guide and inner dilator. Now the doctor will get the Picc line in position with II. So now you're going to anchor the Picc line while we take out the snap dilator. And Viv needs to do a bit of weight training because she's having trouble snapping this dilator. It is a bit snap. Yeah. Then they'll screen again. check the position, it's good. So now the doctor will leave you to your own devices, so then you'll clean the area with your little skin prep. You'll attach your butterflies, your stat lock, and then end with your bio patch, or followed by your tegaderm, or your tegaderm with your Corhex patch. So this is going to make sure the air's out of the pig. This is only a single lesion, so she's just going to draw back. She's got a bit of blood that comes to the hub, and then she's going to flush it with about 2 to 3 mils of normal saline or hep saline, depending on what you use at your practice. Then now we're going to just take this away, make sure the area's all clean. We'll just have a look down there. We're going to place our tegaderm nice and tidy. And there you have it. Single Lumen Picc Line insertion. Thanks for watching.